Thank you for joining me today. In this video, I am going to go over Zika virus. Zika is a virus. So you will understand the clinical presentation of a Zika virus infection. You will learn how the Zika virus typically shows up in a patient. Commonly symptoms, how severe they are, and how they different from similar infections. So you will learn Zika virus in this lecture. We will go over the symptoms of Zika virus. We will differentiate other infections that are similar to Zika virus. So we will review the diagnosis, evaluation, and lab confirmation of the Zika virus. The lab is the NAAT RT-PCR and IMIGO and PRNT. We will analyze the real-world clinical case study scenario to apply the diagnosis, reasoning, and manage decisions and to realistic situations. So we will go over the realistic situations that Zika virus patient will have and the symptoms they have, and diagnosis or labs that you wanted have to know this is confirmed this is the Zika virus. We will discuss the management, counseling, public health consideration. We will talk about how to care a Zika patient, especially high-risk groups like the pregnant individual. We will also cover prevention strategies, patient consulting like travel and sexual transmission precautions, and how the Zika fits into public health surveillance. Zika virus infection. We will go over the Zika virus infection. Zika virus infection is a mosquito-borne virus transmitted by Aedes mosquitoes. Zika virus is a virus and is primarily spread in type of mosquito, that same type that spread dengue and dengue. So it's type of mosquito virus similar to dengue. It is spread sexually and vertical, and transmission also occur. So Zika virus can also spread through the sexual transmission from an infection partner. It also transmits a vertical transmission pregnancy patient to fetus. So if the mother infected can transmit the disease to the patient, to the fetus. So either from partner to partner, either mother to child, mother to fetus that is in the womb. It can also transmit blood transfusion through rare cases. Zika virus is a unique mosquito spread to many other mosquito-borne virus. It's a unique and is mosquito-borne virus. Major concerns include congenital Zika syndrome, microcephalus. So the mother who has a Zika infection can transmit that to the fetus in her womb, and the baby will born having a small brain or will develop a small brain. So it can cause severe outcomes, especially a pregnant woman. It leads congenital Zika syndrome, a group of breath defects causes when the virus infection a fetus. So when the baby get infected the Zika virus, they can develop congenital small brain microcephalus condition, where babies are born with abnormal small head and brain injury. They will be handicapped. And they also develop Guillain-Barré syndrome, a rare neurological condition causing muscle weakness and paralysis in adults. So Guillain-Barré syndrome is like close to MS. I have seen patients who have that. They lose their function. They lose it's hard for them to breathe. They lose their function, muscle function and neural function. So they become weaker and weaker and weaker until they cannot even eat, until they cannot talk, until they cannot. Guillain-Barré syndrome is very bad disease that leads to coma and death. So this mosquito-borne infection can lead to that in adulthood. Infants who get infected when their mother is wounded, they can be born small brain, and they can gradually, when they get older, develop that Guillain-Barré syndrome. So there have been outbreak in a Micronesia 2007, French Polynesia. There was another outbreak in French Polynesia that happened 2013. There was another outbreak that happened in Brazil 2015. Major historical outbreak that make Zika virus global emergency. Those were global, like a coronavirus. They were not like a coronavirus that big cases, but it was big deal because that affect mother and children and anybody else. So 2007, documented the first large outbreak. And then 2013, French Polynesia had a large outbreak linked to neurological complications like the GBS. 2015, Brazil had a massive epidemic associated with macrocephalic in a newborn, leading to a global public health alert. Aeroviral disease rising due to the climate change and urbanization. So that's what happened when the climate changes and urbanization happens. When the people live in the jungles, like the forest, Brazil forest, when there is a mosquito-borne diseases that will come contact to human being. So viruses are spreading more widely. Like what we saw the COVID-19. Climate change expands mosquito habitats to new regions. Urbanization creates crowded area with standing water, ideal for area mosquitoes. So there is a sitting water that creates the mosquito to contact with, to spread, to have large groups, and they can attack the residents who are close to that area. Gather these factors increase the risk and likelihood of mosquito-borne outbreak. Over 5.6 billion people are at risk globally. Because the area's mosquitoes live in the tropical and subtropical and increasingly temperature areas, millions of people living in environments where Zika transmission outbreak occur. So there is a lot of people or a lot of countries that live that area where the atmosphere is conducive to this mosquito outbreak, mosquito disease outbreak, Zika virus. But the Zika virus is not just like a corona that affects you one time and you're done with it. It will affect the child in the womb. It will affect generations. Clinical presentation in severe cases can have neurological complications like Guillain-Barré syndrome and endocephalitis as a severe neurological outcomes. So it will have a Guillain-Barré syndrome, which paralyzes the person, and inflammation of the brain. So Guillain-Barré syndrome is an autoimmune reaction that causes muscle weakness and paralysis. Endocephalitis is an inflammation of the brain potential life-threatening condition. This complication is represent the severe end of the Zika virus spectrum. Not everyone who get Zika virus have that Guillain-Barré or inflammation of the brain, Guillain-Barré syndrome or inflammation of the brain, but it's a risk. So congenital Zika syndrome in a pregnancy. For pregnancy individual, Zika infection can harm the development of the fetus, leading to congenital Zika syndrome. A group of birth defects include small brain and abnormal brain function, placenta and fetal neurotoxin. This point refers to Zika abnormality to infection to the placenta and target the fetus neural tissue. Neurotropion is the virus has a preference for attacking the nervous system cells. This explains why the fetal brain development can be severely disrupted when the infection occurs during the pregnancy. Clinical presentation, common clinical presentation. So 4 symptoms classic commonly represent a Zika infection. So Zika virus has 4 common classical symptoms. These 4 clinical symptoms include low-grade fever, usually mild, not very high, rash, commonly maculopapilla, flat light racing lesion. So there's a rash, but it's a small racing, slightly racing rash. Also has arthralgia, joint pain, often hands and feet. Conjunctivitis, irritable eyes without the pus. So the 4 symptoms, classical symptoms of Zika infection include low-grade fever, rash that is flat, slightly racing, joint pain, and hands and feet pain, eye inflammation, redness, irritation of the eye without pus. These symptoms overlap with dengue and chikungunya, but the mildness of the symptoms and representancy of the conjunctivitis are the special character of the Zika virus. So Zika virus, if you eye inflammation, eye redness, eye irritation, conjunctivitis is typically for Zika virus, not for the dengue, or chikungunya. Mildness, so the symptoms are mild. They lasted 2 to 7 days. Zika virus is usually a short, self-limited illness. Most people recover fully within a week, but it has all that other risk for the children. Often asymptomatic, so maybe the mother don't know that she has the symptoms, the pregnant woman, or anybody else. However, it has a long-term effect. The key epidemiology figures include most infection people never develop symptoms at all. This makes Zika infection hard to detect and easier to spread unknownly, especially concerning during the pregnancy. Typical Zika virus infection is a mild, short-lasting, and frequently asymptomatic, but is still clinically important due to the pregnancy-relevant risk. So it has a very risky and bad symptoms, but it's side effect. It's like a side effect. It will come later, and it will affect the generation and children, but you may not feel it. Diagnostic overview of Zika virus. NAAT verified in the first week of the illness. Because molecular tests detected the viral RNA, which is present in high amount earlier in the disease occurring. Use it for patients who are within the 7 days of the symptoms onset. Then antibody IgG begin to appear around a week after the infection. It is cross-reactive with dengue, meaning the test may pick up antibodies that reacted to both viruses, causing false positive. PRNT resolves a false positive when needed. So the blood reduction neutralization test is a more specific confirmation test. So if you want to know for sure this is Zika infection, you want to use the PRNT test. It's a slide stand that helps resolve the false positive, especially when the IgM is tested are unclear or cross-reactive. You want to use when you want to confirm this for during the pregnancy. You want to know if this is Zika virus, especially if you want to test that in a pregnant woman. We have a case study here, clinical case study. So this patient is a 29 years old woman She's pregnant 22 weeks and she's in her second trimester. It is important because Zika infection during this pregnancy carry a highest risk for the fetus. Complications such as small brain congenital Zika syndrome. This is the key epidemiology clues because it's most risky at that age when the brain is developing. Travel to Honduras for 9 days ago. So this lady, she traveled to Honduras, reaching where this mosquito is highly present because it's tropical area. The timing is 9 days ago. Fetus within the infection incubation period for the Zika. Travel history raises the level of suspicious significant. So you want to assist the patient when they tell you this information. Rash, joint pain, conjunctivitis. These are a classic symptoms of a Zika virus infection. The rash, the joint pain, the conjunctivitis. This triad aligns strongly with the typical clinical presentation describing the early Zika virus. So you want to watch that for. You want to assess these symptoms. You examine our case study. So you did the examine. You examine the pregnant women. And examination result. The patient presented with maculopaptal rash. So she has the rash, she has the conjunctiva injection, classic sign of Zika virus infection, but normal neurological exam. No signs of a severe complication like the Guillain-Barré syndrome or small brain. Stable viralis indicate no symptoms, no systematic illness or distress, supporting a mild and uncomplicated infection. Overall findings are consistent with a mild typical case of Zika virus. But the pregnancy raises concern about the fetal risks rather than mother severity, because it can be mild for the mother, but it will be severe for the child who is in the womb. So you want to do the diagnostic workup, you want to do some labs, you want to assess the diagnostic outcomes. So you collect blood and urine. This is the first line test for the Zika symptoms in patients. Your slide shows that the NAAT is used to directly detect the virus DNA, serum, and urine testing increases the chance of detecting the virus. This is especially useful early in the infection. They are useful in the early infection. Also, Zika virus is, as we mentioned before, has a similar or close with the dengue virus. So because the Zika and dengue are circulating in the same region and they cause same issues, you want to test both of them. IgM becomes detectable later than virus RNA. Virus RNA is quicker than the IgM. It helps identify the infection if the NAAT window has passed. So let's say patient come to you after 1 week. So you want to use that to differentiate. This combined panel is essential because the Zika IgM can cross-react to both infections. You want to also do viral ultrasound, virus ultrasound. Since the patient is pregnant, the slide include a viral imaging as a panel. Ultrasound looks for the early sign of a congenital Zika virus infection, such as the symptoms we talked about. It also serves as a baseline for the future monitoring. You want to take this one now and compare it later if the fetus brain changing when they grow older, if the brain is not growing older with them. Together, these tests aim to detect whether the mother is acutely infected, whether she has affected or a risky. You will use the ultrasound for the fetus, and you want to use the NAATs. They set up the diagnosis confirmation in the next slide. As we mentioned before, the results of the diagnosis, the NAAT, which directly detected the virus, and RNA retains the positive. They become positive. This confirms that this is a Zika virus and actively present in the patient's blood and urine. NAAT is the gold standard for early detection. And then dengue NAAT will be negative. Since Zika virus and dengue present with the overlapping symptoms and circulating in the same area, both are tested. So negative dengue helps rule out dengue virus. Negative dengue and NAAT helps rule out the dengue virus as the cause of her illness. This clinical important because dengue and pregnancy have different management implications. Anticoagulant warning signs confirm Zika infection in the pregnancy. Managing Zika virus principles. So this is virus, is not an infection, so you want to do supportive care, hydration, pain relief. There is no antiviral medication for Zika, so you want to treat the base symptom relief. Only treatment is the symptom relief, like hydration, Tylenol, to support recovery and prevent complications. Avoid NSAIDs until you rule out the dengue. NSAIDs should be avoided early because they can worsen the bleeding risk if the true illness is dengue. Because dengue causes bleeding, if you give them NSAIDs, it will increase the risk of bleeding. Dengue can cause hemorrhage complications, so the NSAIDs are unsafe until tests exclude that this is dengue virus. This is why the diagnosis workup includes Zika and dengue testing. Pregnancy, serial ultrasound, MF referral, that's what you want to do. Because this patient is pregnant, management must be prioritize fetal health. Serial ultrasounds are used to monitor the fetal growth and look for early symptoms of congenital Zika syndrome, like the small brain, abnormal brain. You want to refer mother fetus medicine referral to ensure that the patient receives special high-risk pregnancy care. As I mentioned before, there is no treatment, but you can monitor. So you want to monitor the neurological complications. You want to monitor fetal development. You want to monitor the infection if it's mild, or as we talked about, if it's mild, severe. For pregnancy patients, you want ongoing monitoring. It's essential. This involves, as we mentioned before, ultrasound, that you will check if the brain is growing every stage. You want to have IVIG. Other features, you want to monitor congenital Zika syndrome. Regular monitoring helps detect problem earlier and guide the perinatal care. Plasma exchange. These are the standard therapy for immunomediated neurological disorder, brain abnormality, that's what you want to monitor. So those are the monitoring and the treatment for Zika virus. Prevention and public health. Nationally notification of the disease. So Zika virus infection must be reported to public health authority. This helps track the outbreak in a helps surveillance for the congenital infection, supporting mosquito control response, sexual transmission prevention counseling. Zika can spread through the sexual contact, so counseling is essential. Patients should be advised about the outbreak, avoid and protect sex after traveling to epidemiology area, especially precaution during the pregnancy. Vector control, personal protection measures, public strategy focus heavily on reducing mosquito exposure, include elimination of the standing water, bleaching the sites, inspecting the spray when needed, insecticide spraying when needed, personal protection, long sleeve, you will wear long sleeves, you will close your windows or you will have window screenings. These measures will help prevent both individual infection and community level outbreak. Case study outcome. Patient remains clinically stable because you want to follow up the patient. This means the mother did not develop severe symptoms or complications such as neurological issue or systemic illness. Her Zika virus infection is followed the typical mild courses seen in most adults. Normal fetal ultrasound, and she has a normal fetal ultrasound throughout the pregnancy. Several ultrasound shows no macrocephalus, no brain abnormality, no sign of congenital Zika syndrome. This includes the fetal was not affected by the virus. Healthy infant delivery at the term. The pregnancy ended with the full term. Healthy baby, newborn. No premature birth, no visible congenital abnormalities, no complication at the delivery. This presented that the best case scenario for Zika virus infection during the pregnancy. Despite the confirmed mother Zika infection, the mother stay well. The baby shows no abnormal signs. Not every Zika infection during the pregnancy results in a fetal harm, but careful monitoring is essential. Our takeaways include the diagnostic require combine NAAT and IgM evaluation. Most infections of the Zika virus are mild, but pregnancy has a higher risk. Prevention is essential due to a lack of viral treatment, antiviral therapy. Epidemiology slide that we went over tells us Zika virus has caused a major outbreak in the past 2 decades. It is influenced by the environment and urban factors. Huge portion of the world population lives in the area where the Zika virus could spread or mosquito lives. While most Zika infections are mild, this slide emphasizes the seriousness complications that can occur for the baby. These serious include neurological diseases like Guillain-Barré syndrome and brain inflammation in adulthood. It also has a severe fetal outcomes in the pregnant if the pregnant women get infected. Early detection when the virus RNA is detectable. Zika virus ability to damage the placenta and the fetal brain is higher, because if the placenta is damaged, that means the baby is not getting enough nutrition from the mother. It's hard for the baby to survive, it's hard for the baby to develop, fetus to develop, I mean the baby who's in the womb. IgM is later tested or later becomes available, but with a caution due to across reactive. So IgM is also reactive, as we mentioned. Dengue for the virus that's similar to Zika virus. PRNT is the one you use to confirm an NAAT when a certain is required, particularly in the complex cases. So you use those tests to confirm this is a Zika virus. Thank you for joining me today. Please subscribe and come back. More case study and more lectures. Thank you.